Hi, I'm Dr. Sergio Ramirez, and being invited by RGV Diabetes Association and Happy Healthy Valley to talk about this segment. Today, we'll talk about segment about childhood obesity. The reason or the cause of childhood obesity is complex. It's a multifactorial neurobehavioral eating disorder with increase in fat, and that adipose tissue produces dysfunction, metabolic, biochemical, and psychological to the individual. The prevalence in the United States of obesity is about 20%. It has changed with time. It used to be 4% back in 1960, and nowadays it's 20%. It varies from race as well. It's more prevalent in Hispanics and Black people compared to Asians and white people. Also, another important factor is the social economical level. It's more prevalent in the lower level. Causes, basically, is kind of simple. It's increase of consumption of calories and decrease in activity, so there's no burnout of calories. So the extra calories that we consume get absorbed and being transformed in fat. Other problems that can produce will be physical. When the person is obese, he has predisposed to have OSA, is obstructive sleep apnea. They also can have diabetes mellitus, and they can have other physical consequences like chronic knee pain because of the overweight. In other physical problems increase, as I said, they can have a predisposition to develop non-alcoholic liver disease. And the most important consequences will be psychological. The obese patient tends to isolate, tends to be bullied, and then they have a high tendency to binge. And because of those, eventually will develop anxiety and depression. The treatment, basically the cornerstone would be decrease the caloric intake and increase our physical activity. The most important is the patient's will and the increase of the physical activity. The reason the obesity is so prevalent nowadays is because of the media, the cell phone, computer, so the people is just static and doesn't move anymore. There is solution and treatment for that, but the main reason will be, again, the will of the patient. We can develop programs to increase activity, programs to provide information about nutrition, and basically decrease the amount of caloric intake, mainly carbohydrates, and increase protein intake, as well vegetables and fruits. Locally, nowadays, there are medications we can use in the pediatric population that we didn't have before. We're very excited because medication that it was approved for adults, now it's approved for kids 12 and above, is very, very effective. Also, the most effective treatment when anything can help, at the end will be bariatric surgery, which turned out to be the most effective treatment. Obesity, we have different levels. We have the normal weight, and then we have overweight, and then we have obesity and morbid obesity. We monitor the patients once they reach the level of overweight because of the risk of develop obesity. Once they're at that level, they have a higher risk to develop acanthosis nigricans, where they develop a high levels of insulin and be in a pre-diabetic condition. Along with that, they also might have trouble with high cholesterol and high triglyceridemia, high lipids. And we closely monitor hemoglobin A1C, which is a clue for a diagnosis of diabetes. So in general, I recommend your parents to take your kids to your pediatrician so they monitor the BMI, body mass index, and then they will early detect if there is a risk for your child to develop diabetes and their consequences.